I had a stroke and was seen by the TeleStroke team. 3 months later, I'm full-time back at work.
Nobody wants to think about having a stroke, but when it comes to stroke care, timing is very important. At Sutter Health, you can be evaluated by a stroke specialist 24 hours a day, 7 days a week, through our telemedicine technology. It's like a specialist waiting for you, just in case you need one.
It started on Saturday morning, and all of a sudden, I just felt funny.
Every 45 seconds, someone in America suffers a stroke.
I realized I had a stroke when I couldn't get my right side to work.
Quick and aggressive intervention can greatly enhance a person's chance of recovery.
The TeleStroke program is a way for us to remotely beam into other hospitals and be able to provide expert consultation on stroke patients. And given that stroke treatment is very time sensitive, timely evaluation of the patient is essential.
They bring up this cart, and I had no idea what was going on. And all of a sudden, it came into focus, and the doctor was there.
Can you put your arms out in front of you just like that?
Using telemedicine technology, stroke specialists from California Pacific Medical Center in San Francisco provide one-on-one consultations with emergency room doctors to start the optimal treatment for the best possible outcome.
The doctor on the screen talked to the doctor and the nurse in the room. Then he said that he would see me in an hour, and he turned to the nurses and said, "Transporter, I'll see you in an hour." And that was unbelievable. When I got there, he was there, and I recognized him.
At the typical community hospital, it's very difficult to either get a neurological consultation and particularly to get a consultation from an expert in stroke.
You know, it made me feel really good because this was a specialist. He knew about me. He knew what had happened to me. He had seen me, and then all of a sudden he was right there in the room with me. That was amazing.